Welcome to the educational recording for the topic, Assessment and Intervention for Home Safety Concerns. The Catch Rural Falls program is supported by the Nebraska Department of Health and Human Services Office of Rural Health through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not represent the views of our funding source. I am Dawn Venema. Vicki Kennel and I form the UNMC Catch Rural Falls team. We are both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I'm a physical therapist and I bring the clinical perspective of fall risk reduction to our team. Vicki is an industrial organizational psychologist, so she brings that unique viewpoint to our team with expertise in quality improvement and organizational and team science. We would also like to thank 3 Doctor of Occupational Therapy students, Jenna Bonzoff, Addison Werner, and Katerina Brichka, for their assistance in creating these slides. They also compiled some of the resources highlighted in this presentation and on our project website for this topic. The educational objectives for this recording are to assess home safety concerns as part of a thorough assessment of fall risk, and identify appropriate interventions when home safety concerns are identified as a fall risk factor. The Centers for Disease Control has a nice framework to follow for fall risk management of older adults in primary care settings. It is called the Stopping Elderly Accidents, Deaths, and Injuries, also known as STEADY initiative. STEADY recommends 3 steps. The first one being screening, where you are trying to get a quick snapshot of whether or not a patient is at risk for a fall. The topic of screening is covered in another recording on our website. Steps 2 and 3 are assessment and intervention. They are what follows if a patient screens positive for being at risk of a future fall. Assessment is a step to take where you are trying to identify specific risk factors that place that patient at risk for falling. In other words, why is this patient at risk? Home safety concerns may be one of those risk factors. Intervention is a step where you take action to address a risk factor. The CDC has a nice algorithm that walks you through those 3 steps in more detail. The link on this slide will take you to it online. Here is a picture of the algorithm. Here I'm highlighting those steps of assessment of specific risk factors, which then lead to intervention for any risk factors that are found to be present. And here I'm highlighting the specific risk factor of home hazards to show you that it is one of many risk factors to be assessed, as well as the suggested interventions that follow should the patient be identified as having concerns in this area. Addressing this risk factor is going to start in the clinic and then may continue in the home via referral to other healthcare professionals such as occupational therapists. Assessment in the clinic will support personalized recommendations to keep patients safe and independent at home. It really begins with having a conversation with the patient and/or their caregivers. When assessing for this risk factor in the clinic, you can start by simply asking about common home hazards like clutter, loose rugs, stairs, and poor lighting. Encouraging patients to share any challenges or near falls helps to identify specific risks. Using standardized checklists can guide this discussion while the patient is in the clinic and may also be given to patients and caregivers for home use. A few examples will be shown on a future slide. Clinicians should also review environmental and lifestyle factors such as how the home is arranged, footwear choices, and use of mobility aids. Finally, exploring daily routines and habits like frequency of potential risky activities, things that might require patients to rush their movements, whether or not they have periods of low energy throughout the day, or they need to get up at night, potentially with limited lighting, helps you understand how behavior affects safety. Within the clinic, after assessment, focus can shift to intervention. First and foremost is patient and caregiver education, teaching them strategies to reduce common hazards like clutter, cords, and poor lighting. It's also important to encourage safe routines and create space for patients to share any near falls or safety concerns. The same guided tools or safety checklists mentioned for assessment can also be used as an intervention tool to guide your education. Show patients and caregivers how to use these and review results together to set priorities for improvement. You can suggest environmental modifications based on the safety checklist, such as grab bars, non-slip mats, or better lighting. For some changes, you may need to guide patients in finding community or financial resources to help with home modifications. It is also important to encourage patients to work with professionals such as carpenters or electricians when necessary to make some changes that are a bit more complicated than just reducing clutter, such as installing railings or changing lighting. Your local area agency on aging might be able to provide recommendations for low-cost, local professionals who have the knowledge and skills to make these types of modifications correctly. The link provided on the slide can help you search for your local area agency on aging. Some patients may be resistant to making changes to their home or in their routines, so motivational interviewing can be used as a communication strategy to explore and empower their motivation for change. The link on the slide takes you to a section of our project website on this particular topic for more information. Finally, it may be prudent in some cases to refer the patient to a rehabilitation professional who can assess the safety, fall risk, and functional mobility of the patient within their living environment firsthand. Occupational therapists are very well trained in this area, and in the absence of OT availability, physical therapists would be a reasonable alternative. These rehabilitation professionals may be able to work with your patients via home healthcare, or mobile outpatient services are also becoming more common in many areas. On this slide, we provide examples of 3 resources that we identified that can be used to guide conversations with patients as you assess home safety. These resources can also guide intervention about home safety because they include materials that can be provided to patients and their caregivers for education about changes to make within the home. The first 2, from the Centers for Disease Control and National Council on Aging, are specifically focused on falls and include user-friendly materials in the form of checklists or infographics that can be printed and provided to patients and caregivers. The Home Fit Guide from the American Association of Retired Persons is very comprehensive and supports aging in place in general, which of course includes reducing fall risk. Now, going back to referral to therapy services to address home safety, we wanted to share a little information about what that entails, especially when it comes to occupational therapy within the home. When assessing home safety in the patient's own environment, OT focuses on both the home setup and the individual's abilities and routines. During a comprehensive home assessment, OT evaluates areas such as lighting, flooring, furniture arrangement, bathroom safety, and overall accessibility. Many of the same things on those home safety checklists that are provided to patients and caregivers, but with an expert eye. OT considers how the person's daily routines and goals influence safety and independence, and combine this knowledge with the evaluation of the patient's home environment to provide recommendations. Through this process, OTs can help identify risks and barriers, provide individualized recommendations for safe participation in activities of daily living and instrumental activities of daily living, and collaborate with patients and caregivers to build confidence and maintain safety within the home. Regarding interventions to take place within the home to address home safety, certainly patients and caregivers play an important role in maintaining safety. They can start by keeping walkways and stairs free of clutter, using nighttime lighting in common areas, and cleaning spills right away to prevent slips. Simple changes like rearranging furniture or securing loose rugs can also make a big difference. However, some more major modifications may require a skilled professional or handyman, such as someone skilled in installing grab bars, stair handrails, or installing non-slip flooring, adjusting counter height, or adding ramps for accessibility. OTs can assess the home environment, recommend these types of modifications, such as the best placement for a grab bar in the bathroom, and collaborate with patients, caregivers, and professionals who do that kind of work to ensure these changes are safe, effective, and individualized. Adaptive equipment or adjustment of routines may also help improve a patient's ability to perform tasks more safely. Together, all of these steps support independence and reduce the risk of falls or injury within the home. In summary, patients spend a lot of time within their home, and as such, we should consider the impact of home hazards for patients who screen positive for fall risk. There are definitely some steps that can be taken in the primary care clinic to begin to assess and intervene on home safety, such as conversations guided by reputable comprehensive checklists. Many changes are simple, such as reducing clutter or adding nightlights. Patients and caregivers should be empowered and encouraged to make and maintain these simple changes to reduce risk. For a more individualized and thorough approach, referral to an occupational therapist for an in-person, first-hand assessment and intervention may be warranted. OTs can recommend adaptive equipment, adjustment of routines, or modifications to the home environment to benefit the patient. This slide includes links to many of the resources we mentioned throughout this presentation, and that concludes our presentation on home safety. Thank you for listening.